Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Molly Mraz, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters. It's the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. It has been almost a year that we've been here filming, and today we are introducing the new health officer for Harford County, Dr. David Bishai. And so welcome to our show today, and thank you so much for being here, Dr. Bishai.
My pleasure. It's good to be here.
Welcome to Harford County. It's so nice to have you here. And I just think it's so nice that you are here talking to the citizens of Harford County, and they are able to put a face to the name that they have seen so much in the media the past couple of weeks. So thank you so much for allowing me to interview you today. I think it's really important to let the citizens know what your role is as health officer. What does that mean?
That's a great question. So the health department is the focal point of public health in any given county, and the Harford County Health Department serves as the focus of all public health efforts. What I am is a doctor to all 255,000 people of the county, and practicing medicine for 255,000 people is different from practicing medicine for one person. I am a doctor and I know how to take care of one sick person at a time, but when you're taking care of a county, most of a county isn't sick. Most of a county is healthy, and my job as a public health officer is to keep people healthy. As well as those who are sick or at risk of getting sick, we try to find out what is the most dangerous thing facing them and work with people, and it's always in a partnership to try to counter the threats. And it is a collective thing that we have to do this together. Even with your doctor, you have to work with your doctor if you've come in for a medical encounter. Well, we in public health work with the people and the businesses and the hospitals and the clinics. We're all working together to keep this county healthy.
That's a great answer. Thank you. What about, you mentioned you're a doctor. Can you give us a little bit of your background information, how you got here?
Sure, Molly. I decided a while ago that I wanted to go into something that could make a difference in the world. And when I was in college, I started to learn that there was a lot of great medical products that weren't reaching people. I was really motivated to see that many people had not been vaccinated, many people didn't have access to clean water or things that we take for granted, even in America. And I was looking for a way to make a difference there. So I went to medical school and got a degree in public health called a master's in public health. In order to help me do this. I went on for residency in internal medicine and pediatrics, and then went on for even more advanced study in economics, because I realized that part of the reason why people were not getting access to life-saving medicines or clean water or better houses was economics. And I put it all together, public health, medicine, and economics, and for the last 24 years I've been a professor at Johns Hopkins School of Public Health, where I've been studying how public health makes economies stronger and how economies and economics can help people live stronger and healthier lives. And one of the things we can do in Harford County is use that type of approach of integrating both what we do in the public health department and what we do in our lives and businesses to try to make our county healthier and stronger.
That's such an interesting combination, because those two are related, but I think it's so hard for people to conceptualize and verbalize how those things are integrated, and to be even able to communicate how they're integrated. So can you just talk a little bit about like the research that you've done with economics and public health, and you spent some time overseas?
Sure. Well, I've talked about two ways. How does the economy affect our health? This last year has taken a real impact on the economies of every single country, and countries everywhere are having a recession. Here in America, we're looking at maybe a 5 to 10% downturn in the U.S. Economy, measured by the gross domestic product. Other countries the same. We will see a lot more mortality and higher death rates in America, mostly due to COVID, some due to things that wasn't COVID, but because people didn't get good medical care, there will be extra deaths from that. Children in America are probably not going to have higher death rates due to COVID. Maybe we'll see, but the jury's still out on this. In low-income countries, it's definitely going to have an impact. When a child whose parents are really living on $5, $10 a day, when that child's parents lose work, that child's going to starve. And we're already seeing, and we will continue to see, child deaths due to the economic downturn from COVID. So this morning we just sent a paper to the journal Pediatrics that measures how many children will die in the world in those poor countries because their economies had a recession. We're estimating about 300,000 children. We're not going to die of COVID, they're going to die from hunger and starvation because their parents were out of work because of COVID. So that's one example of the work in Africa. On the other side of the coin, what does public health do for the economy? A few years ago, we wrote a paper titled Green Pastures. But I love the title. What it means is that if you make your county healthier, people will want to be there, like cows want to go to green pastures. So what we showed is that if a county is able to lower its mortality rate and offer 1 extra year of life expectancy in the county, after that has happened, real estate prices go up in those counties with a higher life expectancy because people want to be there. People can sell their houses for higher prices. And so for the 5 years after a county has improved its life expectancy, real estate prices go up by 16%. So we published this. I was really pleased to see that it's had a policy impact, and now we can go to mayors and county executives and say, money that you spend on making your people healthier is going to give you prosperity and higher tax revenue because of a property tax, because people want to live in a healthy county. And everybody who's viewing this knows. When you're going out with your realtor for real estate, yeah, you look at how many bedrooms, how many bathrooms, and what does the lawn look like, but your eye is triggered by, is this going to be safe? Am I going to have a healthy life in this place? And so you, as a home buyer, are finding a way to be healthy. And we called it green pastures because I think humans, just like any creature, wants to be in a place that's healthy. And so we in public health are here for Harford County to make our county a healthy place where people want to be and where they will thrive and prosper.
So Harford County is pretty healthy. We rank among the top 10 of the healthiest counties in Maryland. Why do you think that is?
So a lot of that has to do with who we are and our lifestyle. So this county attracts a large military presence. And military families and military soldiers, they're trained to be healthy. They work out. So that sends a culture of physical fitness and health. I think that has a lot to do with it. The military establishment also wants the fighting forces to maintain that health. I think that's part of it. Mm-hmm. Affluence is certainly part of it. There's no question that people with higher levels of education and higher incomes are going to do better with their health behaviors and health practices. Yet, that's not enough. We as a health department are trying to lift up everybody. So if you're not in the military and you didn't finish high school, a health department can make you healthier anyway. Mm-hmm. We can make the healthy choice the right choice. We can make sure that you have access to schools that help your children get good nutritious food that supports healthy habits. We can give you access to neighbors with ideas that conform to your ideas about how to be healthy and how to treat each other better. So there's plenty to do other than just saying, okay, good luck for you that you had a great military base and you had affluent, well-educated people. There's more than that. There's things that we're finding out already about the county where risk factors that we're facing that it's my job as health officer to work together with the citizens to try to figure out and then address.
Right. You have such important work ahead of you, and you've done so much important work, and you are a published author. You've named a couple articles that you've written, but you recently wrote a book, and do you want to talk about that?
Sure. My book just came out in September. It's called Achieving Health for All: Primary Health Care in Action. Achieving health for all is very aspirational, and it's what all public health departments strive to do. The second part of the title of the book is called Primary Health Care in Action. Primary health care involves not just the primary care doctors of the world, but it involves public health as well. This word has been used in my circles in public health for over 40 years to mean the combination of public health and the primary care community, the pediatricians, the internists, the general practitioners, nurse practitioners, forming that partnership. And so what we did in the book was we looked around the world for communities that had really done a great job making their citizens healthy by combining access to primary care and really well done public health programs. So we looked and found low-income countries, middle-income countries that had gone through this approach. What they did and what they had is something Harford County used to have. They had the whole community get involved in planning for how to be healthy. It wasn't just the job of the health officer. It was done in partnership with the people. The other thing that we found in the book was going to people where they are, going to schools and actually knocking on doors and going to houses. I mean, you don't do that much in the USA anymore. People don't open the door. We used to have community health workers, and many communities do. I'm looking for ways to bring that home visitation method. We do have home visiting nurses that come for sick people. We have school health nurses that are seeing well children on a regular basis. In some counties out in Western Maryland, when an EMS worker is called to a home for anything, if it's not that serious, they'll spend a few minutes talking about the health concerns that they have and practicing preventive health advice in the home. Because the countries that were doing the best practice in my book really had an ongoing way. Every neighborhood had a community health worker that was from their people. One of, a mom or a dad or an uncle or an aunt that, they were senior, they were respected by the neighbors, they'd had some extra training in the health messaging, and that they would be trusted by that community. We're not sending government agents into them. These were lay people mm-hmm. that you know and love and work with. They were now sort of the community health worker to go out and help people understand what was threatening them. Here in Harford County, we're facing environmental health threats all the time. We have problems with sometimes the septic systems aren't working. We certainly have enough Lyme disease, and people are all over getting tick bites every summer. We have concerns that with food storage and food preparation, smoke detectors. There's so many things that could be done with this community health visitation model, but it has to be right for us. Mm-hmm. This is definitely not gonna be taking what they did in Nepal and saying, well, that's perfect for Harford County, which is why we have to do a partnership. We have to see what works given the people and our set of belief and the way we trust each other. It has to be designed by us, for us.
Do you think that you've given so many props to our programs, I think, without even you intentionally doing that, so people can see the local health departments, they can do so much for your community. And we have so many programs that are made to address these needs in our community. And it's just alerting people and letting people know that we have these programs for them, but also the trust in the community is a big factor, and just making sure that people trust us with their information to be able to provide those resources to them. What was one of the things that drew you to Harford County, that made you want to become the Harford County Health Officer?
So one of the things about Harford County that I find so attractive is that people know each other. And there's so many, you go to a big city and people are coming and going, and they're going to come for 2 to 3 years and then they're going to leave. What I found here, and what I've known, because I've been living in Baltimore County for the last 25 years, Baltimore County is more of a suburb, full-time. Harford County has the suburban thing, but it also has the people that are really content living their whole lives here, and it has the military base. That combination of, you get your suburban commuter base, you get your people that are settled and just lifelong residents of the county, and you get the military base, I found that was really a perfect combination for me. I've been inspired by what I've learned about military communities and their ability to support each other in the face of trauma and danger. And during the conflicts in the Middle East, when there were so many deployments, when our military families were so impacted by what they were feeling and seeing and the worry that the families were having, they rallied together and they supported each other. And they know how to deal with trauma. That knowledge base is here now, here in Harford County. And I've already been on the phone with the base commander and then the medical community there. Really, I want that style of supporting each other during hard times that the military families know to cross over into the civilian base. So I'm really looking forward to that opportunity here.
Great. You came in at a very difficult time during a pandemic and COVID-19, and has that been stressful for you? What kind of, how did you cope right now with COVID-19 and becoming a new health officer?
Yeah, COVID-19 is stressing absolutely everybody. We in public health work on this all the time. And there's the danger that it's going to crowd out everything else we actually have to keep doing in public health. We have to take care of other conditions besides COVID-19. So as all the viewers know, this is not an ordinary time. It is the largest public health crisis of the century. But what I find is helpful is the people that we get to work with. When I came in January, we had our deputy health officer, Marcy Austin, and a set of nurses that we get to work with. There's Lisa Swank, who's really spearheading a lot of our vaccine programs, and has rallied around a multi-sectoral approach. As many viewers know, the school system has been so generous in working with us to help us with COVID. We also have staff inside our health department that are mental health professionals, because COVID has had a real toll on everybody's stress levels. So we're at the worst ever, but I'm finding in this public health department the resources and the tools to take care of it. Looking backwards, I do know and I do believe that a stronger public health infrastructure, a public health workforce and public health departments that had been better prepared a year ago would have let this play out better. And as we look around the world, there are countries and there are even counties in the USA that did a way better job at handling and preventing the caseloads and dealing with COVID than the average American county. Mm-hmm. We're trying to learn what those counties did every day. I want Harford County to benefit from that learning. And what are we finding out so far? We're finding out that getting people to trust the health department, mm-hmm. and to say, yeah, I get it. I do have to social distance and I wear a mask. I understand why. I'm not fighting this. I understand. I have my questions answered. The coming battle here, it's winter of 2021, and we have to get that same level of trust for the vaccine. Mm-hmm. We have to get people to understand and get their questions answered about how they can get the vaccine, and what do we know about the safety and efficacy. If you have questions, we need to answer those questions. We're not going to just tell you need to do it if you don't have your questions answered. You need to have a place to do that. And we're building that now. When we're building that in partnership with the people of Harford County. Mm-hmm. We've set up a volunteer work group called the Citizens Crush COVID Group, made up of people from the county rolling up their sleeves and helping us with the messages, the questions and answers, as well as reaching out to the highly impacted senior community that needs to know about the vaccine, how to get it, and where to get their questions answered. So COVID-19 is bringing out the best in our health department, and it's bringing out the best in our residents.
So it sounds like you have a lot of focus on communication with the community to ensure that they trust us, that they are informed, and that they can make knowledgeable decisions for themselves and their health. And I think that's really valuable to have a health officer that has those things in mind. Do you have any other kind of priorities for the health department, non-pandemic oriented?
I do. I think we need to be a lot more aware of where we were in public health a year ago. Before COVID hit us, we had just been looking at the first time in over a generation that American life expectancy had been fallen. It fell in the year 2016, 2017, and 2018, 3 years in a row. And it fell in Harford County as well. Life expectancy fell because of three main conditions. It fell because of alcohol, opioids, and suicides. And we were working on those issues in partnership with the community. They didn't go away. They're still here. Those problems are still here. We're seeing great progress on the other conditions. Diabetes and cancer and heart disease are going in the right direction. There are disparities in those conditions. Some groups, lower educated, lower economic status groups, are having a harder time with those conditions. But these behavioral conditions, we call them the diseases of despair. Mm-hmm. And a lot of our approach to the diseases of despair has been focused on the end of the game. Of you took the opioid overdose and now you're about to die, and we're going to come in and reverse it with a drug called naloxone. Well, that is great. We're going to do a lot more of that. But let's talk about the despair and work on the longer root causes of why are so many of our citizens reaching those points of despair, leading to opioid use, alcoholism, and suicide.
It sounds, oh, sorry, go ahead.
So we need to work on those root causes, and I want to connect that to my inspiration from the military community. The root of despair is the sense of having been abandoned and having no prospects and no social support. That's the root of despair. Mm-hmm. The military community knows how to bring you back from the brink of despair. It knows how to reach out and help you realize how valuable you are to the community. So right now in this county, I want to combine what we're doing with harm reduction, which we are going to continue with despair reduction, mm-hmm. of finding ways to reach out and be supportive long before you reach that point. And it goes back to even the earliest experiences. In public health, we talk about adverse childhood experiences. There's so many ways a child could have an adverse experience. They could have a parental separation, job loss for a parent, incarceration for a parent. They could be bullied at school. Children are going through these experiences, and so little is often done to recognize when a child's having these experiences. It affects the child's brain. We can see changes in children's brains after they have these traumatic experiences, and we can affect them if we reach out early. So we're going to try to find a way to find children who are going through adverse experiences, going through trauma, detect them in the schools, detect them in our community groups, detect them in our neighborhoods, and reach out and stop the despair as early as we possibly can, and be aware of trauma as a community so that we can really put a dent in the future of these diseases of despair. That's really what I think we can go back to as a health department.
So I was going to say, it's, the ACE study, we've done a couple shows about ACEs and how the ACE score affects your longevity and affects disease down the road for you and your trauma and childhood experiences. I mean, it's interesting, to bring that up. We have done a couple shows on that, and it's just amazing to see the relationship between the two, because I don't think people really understand the magnitude of childhood trauma and how that relates as, to an adult. Mm-hmm. So thank you for bringing that up. Where do you see Harford County in 10 years from now?
In 10 years from now?
After you've been our health officer.
So in 10 years, we will see a health department that is surrounded by more connections to the businesses and the people and the hospitals and the schools, the police department, the military bases. We will be on speed dial with each other. And the health department won't be the only show in town for public health. Public health will be done by all of us. We'll all be aware of how we support each other. At that time, this will be such a healthy community. Real estate values will be through the roof, and now we'll have the problem of affordable housing. But we'll solve that too, because we'll be so tuned in to the vulnerable people that need affordable housing. Solving all your problems together is what we're good at, what we will become better at as this community grows and prospers together.
And it'll be all thanks to Dr. Bishai, right?
It'll be a group effort for sure. We've got great leadership in the county government.
We do.
I've really been pleased to meet with Councilman Vincenti and County Executive Barry Glassman. All of the people in county government have been fabulous, and I think they share this vision of making this the county that works together to create prosperity.
I'd say before the pandemic, we were close with our community partners and the county and a hospital and all that. When the pandemic hit, I mean, it kind of forced us to be even closer. Almost like, we do have everybody on call all the time because this pandemic has just taken its toll on the county, but also has really strengthened our community partnerships. And without these partnerships, I mean, I think we would just be in such despair. And so it's really thanks to everybody involved in this pandemic. It's really been wonderful to see the community come together. So we only have a couple minutes left, but I wanted to see what do you like to do for fun? What's your fun stuff?
So right now it's the end of January, and my wife and I are looking at the seed catalog to get the garden ready.
Yeah.
Been gardening for many years, and so we're actually thinking about the garden, even though it's not quite gardening time. So I love to do that, and I'm a runner. I ran 1,000 miles last year.
Wow.
But I didn't lose a single pound. So if you're asking what happened to the 1,000 miles, I know exactly what happened to the 1,000 miles. I have a sweet tooth, and so I ate my 1,000 miles last year.
You eat or you run to eat?
I run to eat.
Right,
is
exactly.
a great way to put it.
We had somebody on here a couple years ago, and she said, you can't outrun a bad diet. And she was the diabetes prevention nurse we had on the show. It was just funny to hear that. Because some people, they exercise so they can, have a brownie or something.
I still want to lose a few pounds, but I'm still working on the willpower sort of thing. And I adore sweet desserts. So
there you go.
I just need to find a way to say no to cookies and pies.
Hey, it's nice to have somebody honest who can say that and be good with it, What about, so you're a doctor in the ER, you are a published author, you are a teacher at Hopkins, and you're the county health officer, and I just want to know, because in the past month, I just want to know if you sleep.
Well, I got a Fitbit that tracks my sleep, and I've been doing okay on really no change in the sleep pattern. So I could do better. But everybody has to sleep according to what they need, and I don't need 8 hours. I'm pretty good most days with 6, and so I'm doing okay with that.
All right.
So we'll be looking into the sleep aspects of public health as time goes forward.
That's so funny. You've been very inspiring to me so far with your speed at which you want to accomplish goals, your insight to different aspects of public health, and I've learned so much of you already in the past month that it's just been amazing. And so we welcome you to Harford County. We're so happy to have you here, and we especially thank you during the pandemic because it's been hard work for you in the past month, hasn't it?
It's been a real learning experience.
It has, and so we just thank you so much for being here today, and we will learn more from you because you love doing interviews and appreciate your communication style. So thank you so much.
Great.
And that is all we have time for today. I would like to thank my guest, Dr. Bishai, for being a good sport and allowing me the opportunity to interview him. Please join us next time for another important health issue that matters the most to the citizens of Harford County. Thanks so much for watching. So how'd that go?
Public Health Matters, brought to you as a public service by Harford Cable Network, your county connection.